Olá, in Portuguese. So I'm here to talk about the role of multidisciplinary team in delivering empathic care. I know this is the basic, but I'm also a mental health and psychiatric nurse, so I really like the basics because how else start to be built with good foundations. So a good teacher of mine told me that we should start with thank you, and I will thank Viv and I will thank all the endorsement. I thank you for inviting me, and thank you for all my colleagues. And by the end of this talk, I really want you to observe this, to enjoy this talk, but most of all to act on it. Empathy is really difficult to teach, but it's a clinical competence. Is collaboration, because we know that it allows better outcomes, as well as communication is really difficult, but is the foundation of care. And as we all know, language matters because it's the key to end stigma. And I really like this quote of empathy is not an emotion, it's a clinical skill. Again, the evolution of HIV care, this is not new for all of us, has evolved dramatically from fatal to chronic and manageable disease. And this shift, the change of our mission from helping people survive to helping them live with quality of life and dignity and empathy. But what is AMDT? The AMDT is a collaboration of all approaches in healthcare, and I put all of this. This is not actually, this is like a unicorn in my hospital. It would be loved, and we know that across Europe, the MDTs are not all available with these professionals, with ID specialists, primary care physician, nurse, care manager, social worker, nutritionist, peer navigators, but clinical pharmacists and mental health professionals, but it's doable. And each of these elements brings unique expertise, but empathy connects them all, because in the end, the collaborative benefits to integrate medical management, comprehensive care coordination, improve patient outcomes, and collaborative care plan, tailored plan is really important. And the impact that this has is seamless with medication management, patient-centered education and patient-centered care that I start to talk about, and improve adherence in the end. But for this, we need to share information. Providers educate on HIV management and self-care. And in the center of this, we have empathy in HIV care. That is not a soft skill, it's a clinical skill, and it builds trust, strengthens relationship, and improves communication. Our goal as healthcare professionals is to make empathy visible and measurable, and this is really difficult to do. So why empathy matters? It matters because it builds trust, it improves adherence, it reduces stigma, it supports mental health and emotional well-being that is really difficult in the world today, enhances understanding through clear, compassionate dialogue, strengthens partnership with the MDT that puts the person living with HIV in the middle and leads to better outcomes and quality of life. Again, shared decision-making, presents options clearly, encourage patients' preference, and foster ownership of a care plan. And now, also the medication is shifting and it's transforming. So I want you to do this exercise and ask yourself, did I listen more than I spoke in my last consultation that I have with that person? Did the patient really feel heard? Did I help reduce fear or shame? And how we communicate. I don't think and hope that all of us know this. Most of 90% of our communication is non-verbal, has to do with the tone of voice and body language. I'm really a fan of non-verbal communication. But in clinical settings, this means that how we say something is often more important than what we say. So empathy, communicating, relies mostly on non-verbal cues with presence, tone, and genuine attention. Why this is important? Health literacy. who defines health literacy as the ability to assess, understand, appraise, and use information and service in order to promote and maintain good health and well-being. Well, for a person living with HIV, this means that he obtains information, he understands the information that is given, and he uses it for a better health outcomes. And we believe that empathy is understanding and action into one. So, again, builds trust, reduces stigma, and improves outcomes. Common barriers of communication, we all know. Technical, medical terms, time pressure. Time is a barrier all across because we're having more and more people coming to the clinics and less MDTs and healthcare professionals working, the bias and assumptions that we do. So this is why patient report outcomes are really important, and the patient fear and shame, because they don't only go to the ID clinic, they go all across and they navigate all across the clinical and health. So tools for this: overcome barriers, use person-first language. If you don't know people-first charter, you can scan the QR code. It's culturally sensitive. It's translated in a lot of languages. I think I will need help, but I think it's more than 20 languages that is translated. And it replaces judgmental with curiosity and creates a safe space. And I bring you this project Acolher, in Portuguese. Is a community health and screening for refugees and migrants. It's a Portuguese national initiative by the Portuguese Society of Health Literacy, that I'm a member, led by Professor Catarina, and has an MDT with nurses, physicians, PTs, nutritionists, physiotherapists, psychologists, social workers, dentists. We work across all together. The core message of this is, and Acolher, this in Portuguese, but is to support, care, listen, connect, humanize, and empower. And the message is not only about treating illness, but empowering people to live with dignity, health, and hope. And we do this. We go where the people are. We go to schools. We go to their communities. We go to their nursing homes. We go and meet them where they are. This is with the values of inclusion, human-centered, and culturally sensitive. It promotes and it bases in 3 big pillars: empathy, literacy, and is culturally sensitive. And again, empowers through education. We have a lot of areas of intervention, as you can see, with multi-professionals, and we do screenings, but we also, again, teach, and we really empower people to do and to choose better health for their selves, with basic health, mental health, nutritional health, oral health, sexual and human health, and infectious disease as well. And all of this, with all of these MDTs that we put together, that we don't work in the same hospitals. Portugal, I don't know if you know it, but it's a small country and you go from north to south really easy and quick because of all the intervention and people that we have, but it's based in this acrimony that I also bring from the Portuguese Health Literacy Society, the ACP Health Communication. We must be assertive, clarity, and positivity. And this is what? Assertiveness is setting clear goals, communicating needs directly and respectively, and listening actively. For example, the healthcare professional clearly explains medication while encouraging questions. For example, what questions do you have for me? How do you feel about your treatment? And with clarity, it's using simple language, avoid technical terms, and ensuring the message is understood. For example, not the term hypertension, but talking about high blood pressure. And this technique of teach-back method, this, can you please explain to me what I told you? Can you please resume the plan that we have come across together? With positivity, this is using positive language, focusing on achieving actions and creating a climate of trust. Example, instead of saying, don't do this, the professionals should say, let's try this other approach because this is better for your health. What do you think about this? So, empathic behaviors that heals, and we really believe that, listening without interrupting, and today with the digital and the computers, and we have to type everything in the computer, we know it's hard, but it's just 1 minute, just looking to their eyes and really listening what they're saying, and to validate this resilience, because in the end, what we really want is empower and resilience people, and offer hope and reassurance. Micro skills for empathy is talk warm and calm, slow and peaceful, and words with compassion and clear again, and encouragement is also really important in the end. This is not for you, I'm not going through all this board, but just for your information that in resume, we have verbal things, what to say, non-verbal things, what we should do, because in the end is the message that we want the final answer. For assertiveness, we really want confidence without aggression, and this builds safe, and the patient feels safe. With clarity, we really want this understanding to go and leads to more adherence. With empathy, in the end, what we need is emotional presence that heals beyond medicine. And this has some key topics of verbal and non-verbal behaviors that all of us should have and do. So in conclusion, HIV care has evolved to reactive to proactive, and from disease-centered to person-centered, and empathy is essential for quality of care. Again, sorry. Oh, I'll go back here for the picture. And then, key takeaways. Use assertive empathy. Be confident, but be kind most of all, and kindness is really lacking in the world. Prioritize clarity and reduce anxiety and improve adherence and well-being as well, because in the end, what we want is high well-being. Express empathy verbally and non-verbally is really important. And communication is a clinical intervention, not a soft skill again, because I really believe that empathy transforms care and outcomes. Thank you.